information. This is something great. We've got a portal, but this is for people who actually have internet access, people who speak English, people who have some degree of basic understanding when it comes to medical jargons. So that on its own is actually going to exclude a great number of people who actually need information and who need better access to healthcare. And I think part of addressing the issues of inequality to access is also being able to identify who are being excluded, who are the more disenfranchised. And then as we move forward, as we build upon what we are doing now, we decide and we focus on how to then bridge that gap between what we're doing now versus getting all those people on board. And I haven't even begun to talk about those who are unable to see or unable to hear. There's all kinds of challenges there as well. So I think if we want to just look at information, there's the issues of language, there's the issues of connectivity, there's the issues of disability. So these are things that I think moving forward, once again, not to say that this is entirely the responsibility of this particular portal, but as a holistic approach to how we do things as societies as well, we need to be very aware of who are the people who are not getting the information and then doing what we can to address those issues.
Another facet that perhaps is not talked about as much as it should be is this idea of political will when it comes to healthcare reforms. And I'm going to direct that to you, Dr. Arasu. In terms of political will, what are the most pressing issues according to the Malaysian Medical Association?
Every issue in healthcare is a pressing issue. But let me just try to relate something that to what we're doing today. So I would say that we have seen the Auditor General's report is understaffed, overworked, underfunded. So one thing we know is that our healthcare professionals, especially in the public sector, emergency department, clinic kesihatan, they actually overworked and understaffed. And we can see that most of those cases are seen in these places. A lot of green cases, which actually they may not really require to see a doctor at that time. So how do we address that issue? So probably a portal like mysihatpal, whereby we give health information. But giving health information is one thing. But what is more important thing is that how do we bring up complex healthcare information into a layman's understanding? So that is very important. Because for me, I'm a GP, I'm still practicing. I see this on a daily basis, whereby patients are very confused when they Google, okay, and then every day I used to guide them which are the good portals for you to go and see. One good portal is, of course, Ministry of Health portal, so it's very good. And then one of my favorite is Mayo Clinic. It was very simplified, but of course, those portals are for more those who are affluent, who understands. So my SEAT portal will be more towards the Malaysian flavor and also more towards those ordinary people that we see on a daily basis. And definitely this will be very helpful, at least to a certain level. Even if you can reduce 1%, it makes a lot of difference in the healthcare system.
So can we have your assurance that you are going to be adding mysihatpal to your list of recommendations?
Of course.
Thank you. Thank you. I'm going to take questions from the floor. If there are any questions. Sorry, spotlight. No questions. Mr. Vinod, can I address the elephant in the room? mysihatpal is not a new idea. There are countless other health websites, microsites, platforms out there. What sets mysihatpal apart from the rest?
What we really try to do here is to match our offerings with the patient journeys that we see across a lot of the common conditions that are represented here. So what we are trying to do here is to make sure that a patient that's seeking health information starts off with an understanding of the disease, common conditions, and being able to take that and empower themselves to take the conversation next to a healthcare provider, professional, to seek the care that they need. Right? So you're right. I think there are many sources of information. Healthcare information is quite distributed in that sense. What we're trying to do here is to simplify that process for patients, and with the partnership with the 9 societies here and maybe more to come, we are providing that ability to provide that one-stop shop experience where a patient can get all the information they need, at their fingertips. And I think things are only getting better in terms of the digital footprint. So we hope that with this start, we'll be able to expand the offerings to meet the needs of patients.
That makes total sense. Dr. Helmi, earlier on, Dr. Arasu shared his own kind of lived experience as a GP, as a consultant working in a hospital, and as somebody who's heavily involved with societies. How do you see mysihatpal assisting healthcare practitioners in their day-to-day kind of dealings with patients?
Suppose I can follow his footsteps and start recommending the websites to
Thank
patients.
you.
Is that the answer that you're looking for? I can move on.
Happy for you to elaborate.
So I'm here wearing my Asthma Malaysia hat, but as a respiratory physician, I think one of the most challenging issues is actually dealing with cancer. This morning, a patient of mine passed away, and this is a patient that I had looked after for quite some time. And in that journey, that from the point of time when he was diagnosed all the way to the point where he passed away, the challenges are not always medical. The challenges are sometimes emotional, psychological, spiritual. And once again, when you are faced with that knowledge that you've got a finite amount of time left, you start to perhaps at times behave a bit more irrationally, or you become a bit more emotional, knowing that there's only a specific amount of time left. And when you're in that position, which we wouldn't want to wish upon any one of us, any of our loved ones, once again you start to look for hope. You start to become desperate. And my number one enemy is the folks who are charlatans who take advantage of these individuals with products, advice, management guidelines that actually have got no basis whatsoever, but ultimately squeezes my patients to the point where they are drained from resources, both emotionally and financially. So that's the kind of things that I would want to avoid. That's the kind of things I want to be able to empower my patients. This is what it should be done. It's not just me saying it. Look, there's a whole bunch of professionals out there who think the same. These are the things that can potentially give you some hope. But then don't be misled by all the different 1 million different pages out there that can guide you in the wrong direction. So that's what I would like. I would like to see more of this, more of being able to help my patients make the right decisions.
Dr. Arasu, as Mr. Vinod and Dr. Helmi, sorry, we do have a question from the floor.
Yes, thank you for picking up my question. So this question is for Mr. Vinod. There's a very healthcare website, microsite and portal that are helping the raise of public awareness of disease. But what is the differentiation of mysihatpal and other digital sites?
I believe that question has just been answered. Would you like to reiterate,
Yeah.
Mr. Vinod?
No, I think it's a common question or comment that comes to mind when you hear of one more portal that's trying to address a healthcare topic, right? But I think what is unique with mysihatpal is the fact that we've got our patient societies here who are providing credible information and suggestions based on guidelines that are accepted in Malaysia regionally and globally as well. So when you access information here, it's been endorsed by the societies, so you can breathe a sigh of relief that it's going to be credible. It's not going to be something that you need to worry about in terms of accuracy. Right? It's going to be credible, quality information that's going to help patients get the right information they need.
I hope that answered the question. Thank you. Dr. Arasu, we've talked a lot about misinformation, credibility, accuracy here today. In your experience, how would you, I don't want to say rate or rank, but how would you kind of quantify the public's awareness when it comes to health literacy? How far do we have to go? And I know that there is inequality. Some people are far more health literate than others. How do we bridge that gap?
Okay, this is a very interesting but difficult question to answer. Okay, but when we speak about health literacy, right, it depends on which income group are we talking about. Okay, if somebody in the top 20% of upper middle class, they know what to do. But the bottom 40% is not to say they don't know what to do. They know what to do, but they are helpless because of various reasons. As we know that 80% of health determinants are non-medical. Right? So at least people like that will go through mental stress. Okay, mental stress. So where do they turn to? So in my own practice, I see on a daily basis at least 3 or 4 cases of people who actually needs some sort of basic to progress, then it become a full-blown mental illness. So at least you have a whereby number one, they can access for information, basic information. But then what do you do after accessing the information? But at least you can choose whichever the professional group that you want to speak to. So at least there is a channel for somebody to seek information, and after seeking information, what to do next. So at least mysihatpal gives such kind of avenue to this particular group.
As we've seen in so many other industries, the way forward is digitalization. That's what's going to bridge the gap. If there are no more questions from the... Oh, there is a question. We've got 2 questions from the audience. Could we get a mic? Would you mind just identifying yourself for our panelists, please?
Hi, my name is Li Jin. I'm from the Pharmaceutical Association of Malaysia. Thank you very much. I think this is a wonderful initiative to have mysihatpal. I just have 2 questions here. My first question is probably towards Dr. Helmi first. I'd just like to understand about the selection of the partner societies, because I see that here, very good selection, but because we are moving towards an aging society, and I was wondering why among the partner societies there have not been any more associations that represent the aging populations, mainly because I also sit on the board of the Arthritis Foundation, of the Menopause Society, so I don't see them there, but perhaps that will be the next step. So I'm just wondering about the selection. That's my first question. My second question would be the sustainability of this. So I would like to go back 20 years ago when I was sitting among the crowd as this portal to stay, very huge potential. But what is the likelihood you'll still be here in 5 years' time, 10 years' time? That's all.
Thank you for your questions. And perhaps I'd like to address the first question to Mr. Vinod. Yes.
Thank you, Legion, for the questions. I think today is just a start. I think we've made an attempt to work with some of the patient groups, the societies that we work with. Right, so it's a start. But I think, as I said in my remarks as well, we are going to open it up to new partners to cover areas that are not covered today. Right, so this is the start, but we'll try to make this as comprehensive as we can. Anyone that's seeking health information has something here for them before they go to the next step. Right? So that would be the second question is around sustainability of a platform like this, and what would this be like in 5-10 years. I think that depends on everybody that's part of this to continue to keep this idea fresh. But what gives me hope that this is quite relevant is the fact that even if you look at the priorities of the Malaysian government, health white paper just recently published, there's a huge focus upstream on early diagnosis, educational initiatives, strengthening primary care. So those are the types of things that the government would like to see over the next 5-10 years. And tools like this only enhance those ideas even more. Right? So that gives me confidence that we can, the public-private partnership that I mentioned earlier is quite aligned. So that there is something to do over the next 5-10 years as we evolve, get to the next challenge, and we will make sure that as a group we take that down. So it's a journey with more to come.
Thank you for that. I believe we have one more question. Is that right?
Yes.
Could you please identify yourself, sir?
My name is Paul. Okay, the question can be open to the floor. Since you mentioned about the public can actually access to this portal, is there a subscription fees? Question number 1. If there is, what is the fees? If there is not, do the public need to register to the website or the portal? And the last question is, if they register, what about the data security and the privacy?
Just Mr. Vinod, if you don't mind, that's information that we're not privy to at the moment just yet, because we're working on the portal as we speak. Today's just a media launch, but I'm happy to take your question offline. Our PR team is situated outside of the registration table, and they'll be happy to get back to you with the answers to your questions. All right?
Thank you.
Thank you. I think we have one more question. Sir, could you identify yourself?
I'm Andrew Tan from Malaysian Pharmacy Society. Okay, there's a question. I think same question, but what I highlight here is that because I see all the association collaboration is not health provider, which is a doctor and then also patient association. Here I want to highlight to the organizer. Community pharmacy is one of the very important in this primary care in terms of providing healthcare information. So I think nowadays, most of the patient, I think after seeing doctors in the GP clinic or hospital, probably they will ask pharmacy, in the community pharmacy about the medicine. So most of the time, community pharmacy provide information to the patient. I think this is a good platform. I think we should engage community pharmacy in this so-called helping the community, especially the patients. So this is one of my suggestions. Please look into it. Thank you.
Thank you very much, sir. Your insights and input are well noted. As Mr. Vinod said, this is just step one of a very long journey. So what I'd like to do at this point is perhaps just pass the mic back to Mr. Vinod. A couple of closing remarks before we wrap this up.
No, thank you. And again, thanks to everyone that's made the time to be here, to be part of, I think, an important moment in providing healthcare digital, a portal to provide information in a digital format. I think this is just a start of what we can do, digitalizing healthcare information. And I'm quite excited that we've got the partners here covering a variety of disease areas, and we are looking forward to making this even bigger in the days to come. Right? But if I leave you with three messages, number one, this is about empowering patients with an accurate medical information, disease information, to help them in their treatment journeys, to provide a closed loop system where it's not just about getting to access to disease information, but being able to access different partners in the healthcare ecosystem from the portal. This is going to be a key part. And the third one, which we also talked about later, is the idea around sustainability and equity, to make sure with a digital platform we are able to reach more patients and give them the information beyond what is happening today. So those are the three aspirations and objectives behind this effort of mysihatpal, and we look forward to more milestones to come.
Thank you very much. Ladies and gentlemen, a round of applause for our panelists, Mr. Vinod, Dr. Harani, and Dr. Arasios, to take their seats. Ladies and gentlemen, as I mentioned earlier, if any of you have any further questions, please do reach out to our PR team.